go before you and behind you and beside you, all around you and within.
Hey guys, it's me. Most all of you know that today I had to go to the gynecological oncology practice at UAB Hospital. And I'm going to give a trigger warning. If speaking of cancer bothers you, even though you're in a cancer channel, or chemotherapy names bother you, or trigger bad memories, I'll give you just a little bit to find the X to leave, because I don't want anybody to be triggered. So just give me a minute. I've read over this stuff, and it's like Chinese, some kind of gibberish. I don't know. Okay. All right. If they're not gone, they'll go now. Okay. The first final report that I got was chest. They split mine chest and then abdomen. Okay. I don't want to look like I'm reading off of this, but I really don't know what I'm talking about. I'm just reading you what it says. And more than likely, y'all won't know either. But I'm going to read you what's going on and then what's going to be done. So, okay. They did a CT chest scan with contrast. Okay. Okay. My lower neck was normal. Nice to know. Considering I do have hypothyroidism. So that's why they scan a little bit. Normally they scan here, but they scan on me because you know, you can get cancer in those too. Okay, now lower neck normal. Okay, chest lines and tubes. That's part of your chest. Tip of the right sided port catheter is at the SVC atrial junction. I don't really think that's anything important. That just means that it's in the right place in the artery up here. I didn't even have to read that part, but I don't know what I'm looking at. So, okay. Let's see. I have some dilation of my esophagus where I had a previous surgery to fix acid reflux. That's not cancerous. Okay. Now here we go. Lymph nodes. Enlarged right hilar, Hilar node is 18 by 20 millimeters on series and then there was another one that was 11 by 14 millimeters on the other lung. No additional enlarge in thoracic lymph nodes. That's good. Cardiovascular. No cardiomegaly or pericardial effusion. The ascending aorta is normal in caliber. The main pulmonary artery is mildly enlarged at 32 millimeters. Not good. But I also have that sarcoidosis. I don't know if that makes any difference. Okay. Lungs, airways, and pleura. No pleural effusion. No pleural calcifications are seen on the right, suggesting previous pleurodesis. I think that was that surgery I had with the talcum powder. Separate tiny nodules are seen along the right and minor fissures consistent with intrapulmonary lymph nodes. The lungs are otherwise normal. So there's something there. The rest of it looks okay. Chest wall and musculoskeletal. No focal destructive osseo lesions. So there was nothing on that. Okay. Lungs. I mean, it needs to be taken care of. But since I'm seen every 3 months, I got it caught. That's the only thing. Now, here's the final report for the abdomen and pelvis. Here comes the fun. All right. Clinical information, ovarian cancer, and the reason for the exam, ovarian cancer. Okay. Oh no, I'm gonna sneeze. I'm not starting the video over for that. Okay. That's what they injected me with. Okay, liver. New hypo-enhancing mass in the posterior inferior right hepatic lobe, measuring 1.9 by 1.7 centimeters. On top of what I already have. That did not change. So now I've got 2 places on the liver. Biliary tract normal, pancreas normal, spleen normal, adrenals normal, kidneys normal. No lymph nodes were enlarged in the abdomen. No abnormality in the small bowel. Then there's peritoneum mesentery, and it says progressive interval enlargement of a left pelvic peritoneal nodule. They call it nodules. It's cancer. You might as well say tumor. They just do that, like, to make people feel better. But, measuring 1.7 by 1.3 centimeters in the region of the prior ovarian tumor. So right where my other ovary, the big ovary that swelled up was, that's where the cancer is. But it's on my peritoneal cavity, which is like my abdominal wall. That's the way she explained that. Okay, right peritoneal nodule measuring 1.9 by 1.2 centimeters. New peritoneal nodules in the right posterior abdomen and within the midline deep pelvis. My bladder is 100% normal and where it should be, and my kidney function is top. So that's good. Reproductive organs. Let's see. Uterus is absent. No definite vaginal cuff nodularity. I'm glad it was no. Body wall. Nothing. Nothing musculoskeletal. So it said in conclusion, she said 4 different places I have those peritoneal nodules. It says, yeah, new posterior inferior right hepatic lobe lesion, likely a metastasis, which is like metastases, or maybe that's the way you say it. Maybe that's just the way you say it. Okay. That is that. It's a list. It's a scary as hell list. Okay. So now I have to go through chemo again. Except this time, it's 3 medications. And I have to go every 2 weeks instead of every 3 weeks. And I've got, first off, you know, you always hear about me saying I can't feel my feet. Well, that's from chemo. And since I'm having one that I've had before, they have this place here. It's called Norma Livingston Ovarian Cancer Foundation. It's just like a lunch bag cooler. But what was in it, they donate these because they're expensive on Amazon. I have to put these in the freezer and keep them in there for 24 hours. She said, basically, when you get home, put them back in there and don't forget them. So that's means no selfies, no updates, because I'm gonna be froze. And then it had the these can be used hot or cold. Gel relief socks. They are very stylish. Very, very stylish. And this is what I get to figure out. Where each one of these little icy things is going to go in there. But I'm sure there's directions. So, that's that. Now, let's see. Okay. The one of the, I don't know which one I'm getting. I'm getting them all on the first try. But then there's like one I have to get every 2 weeks. And then the other one's every 4 weeks. So I'm in there every 2 weeks. But there's like 2 at one time and 1 at one time. And then 2 and then 1. I don't know. They're going to put it on the portal and schedule it. I'll just go. But I'm getting carbaplantin, which I had, and my body reacted very well because it helped shrink down my ovarian cancer to where they didn't hardly find anything. So yeah, I'm just looking at the papers. I'm not doing side effects and stuff, except there is one. Now here's one. Okay, I don't know how to say it, but it says the trade name is Avastin, Avastin. So, yeah, yeah. And the thing is, one of them, I'll have to drive all the way down there for 15 minutes. This one's, every 2 weeks, she said. And this one is over 90 minutes. So it's going to be a while. But not anything like it was before. Then the one that's scary is doxorubicin liposomal. She said do not look up doxorubicin. Look up liposomal doxorubicin. And that'll give you, because one of them is horrible, but they still list it that way. But the name of it is Doxil, Doxil, every 4 weeks. Now the obvious questions, and you guys question down below. Give me some well wishes and prayers. That doxorubicin, she said, is likely to cause, but not in everybody, a fissure. And I was like, do what? And she said a fissure, which is like, say this is the vagina and this is your rectum. This really thin, very paper thin little thing, little piece of meat that separates them, it will weaken, and if it does, it's not good, and they have to take you in for surgery to repair it, because it can be you know, dangerous, they said. They had me scared. But my hair won't fall out. She said it may thin just a little bit, but she said, you got plenty of hair. You've got a head full of hair. I didn't even recognize you when you first walked in. And I was like, well, I hadn't been here since March. Yeah, every 3 months. They ran about 20,000 blood tests. I know I'm exaggerating, but the truth is the truth. But this is going away. Somebody went, God, what did somebody do to you? I said, them people in the radiology clinic stuck me 5 times. And the bad thing about this one is it went in like right here between the knuckles. And that makes me like, I stiffen up because it's so painful. And I can handle pain. You know, anybody that's been through what I've already been through is used to some pain. And I asked her, I said, why is it all of a sudden I started, like, my abdomen started, like, getting bigger, even though I was losing weight? And she said that's just one of the side effects. It's fluid or ascites. But as long as it doesn't get too out of hand, or if, you know, I don't know what can go wrong with it. They don't really, I mean, I'm sure if I read every bit of this stuff, I'll folder. And of course I'll read it, but yeah. It's Monday night. Let's see if it tells me on the TV what time it is. Of course not. And I'm on my phone, so I can't tell you what time it is. But I think it's about 10 o'clock. I got there. I heard something. Anyway, I got there at 1:45. I didn't get home until 6:15. It was horrible. I still haven't cried. It'll hit me, or maybe the Lord is just protecting me. So if you made it to the end, type in nodules. NODULES. Type in the word nodules. That way, I know that you made it to the end. And if somebody only watches 3 minutes and then asks me all this stuff, I can go to the video. Go to the video. But it's going to be worse before it gets better, just like with every cancer treatment. But she's not expecting at my age for me to have any problem with the Fishers situation. And I said, how do I know if I have that? Because, you know, I'm single. Ain't nothing going around in there. And she said, oh, you'll know. You'll know. It's not pleasant. So, anyway, if that has happened to any of you, please comment and tell me how bad it was. But that's pretty much all the information I have. So, Jesus saved me, and he'll save me again. If not, I guess I go home. I love you guys. I appreciate each and every one of you. And I'll see you in the next one.